Hello, I'm Suhail Mirza and welcome to the second of two special episodes of Voices of Care, which is coming from the Care Show in Birmingham. The adult social care sector is vital to our nation, and we continue in this episode to hear from more leaders sharing their wisdom and insight about how the sector and its workforce can be truly appreciated and honoured for the contribution that it makes. So join me for this second special episode. I'm absolutely delighted to welcome once again Raina Summerson, Group Chief Executive at Agincare, to this episode of Voice of Care. Raina, thank you so much as always for giving us your time.
Thank you for inviting me. It's always lovely to chat.
Absolutely, and I'm going to start off first here. You've driven up, I think.
Yep.
Tremendous buzz here at the Care Show.
Oh, it's fantastic. I thought last year, which was the kind of first real event kind of post-COVID, was great. But yeah, the atmosphere today seems even better and really well attended. And as ever, it's just a key place to network, to bump into people and to find out about what's going on across the sector. I think Michael and his team do a fantastic job. So yeah, really good to be here.
Absolutely, and it's a time to celebrate the sector. There's challenges which we'll come on to, but absolutely a time to celebrate the sector. And I think, I hate to remind you, but I think it's your 20th year now at Agincare,
and pretty much.
Incredible journey for the business in that time.
Yeah, no, we have. We've seen a lot of growth. I mean, as we've said in previous discussions, sometimes it doesn't feel like much has changed, but we have to reflect on how far we have moved on and how good things, what good progress has been made. And I think the networking in the sector and the strength of alliance and the conversations that are had, despite it being quite a dispersed sector, I think they have really strengthened over that time. There's some really real feel of togetherness and.
And that's, I think, also you touch upon that because things, as you say, sometimes it doesn't feel as if there's been much progress. You and I have had many conversations about very similar topics, but I think you've said in a recent article, I think with Care Management magazine, the move, we've seen some profound moves in social care, the move from institutions to people's home, and also new models of care.
Yeah, and regulation and the quality, the expectations around quality. I think the expectations around the involvement of people with lived experience and the kind of elements of choice and control. We've still got a long way to go. We still do far too many things to people without people. But I think that movement in that time, there has been a real shift.
I think one of the things that, of course, that I don't know if you want to call it an elephant in the room, it seems to have been there for a long time, is the question of funding. We're moving into a period where there's going to be a general election, almost certainly in the next 12 months. And the Future Social Care Coalition recently produced a report, cross-party, and called it socially unjust that the sector was underfunded. There's been a recent injection of 570 million into the sector, which I think translates to 9.6 pence per hour for the workforce over 2 years. We've had this conversation before, but this remains a huge issue for all providers and all stakeholders, and indeed everyone in the nation.
Absolutely. We still haven't sorted out how as a society we're prepared to fund and to what extent we're prepared to fund social care, and that affects not only the people drawing on social care but the people that work in it. And I think we've heard, as you said, we've got lots of noise around social care coming out from the different political parties, but the worrying thing is there's noise around things like workforce strategies, around minimum wage for care workforce, around free social care, the Lib Dems said, didn't they, last week? But actually no one then follows that up with, and this is how we're going to fund it. And until we work out how we're going to fund it, we are not going to get this longer term strategy that really underpins proper planning. And I think you mentioned the money coming out. We get these big amounts of money. The public think they're big amounts of money. It sounds great, but when you break it down, it's so little coming into the sector, and it's so short term, and it's still late in the day. So it just doesn't have that lasting impact that we so desperately need.
I think the Health Foundation have said if we're going to move the dial, I think the funding in real terms for social care is up by 2.6% from 2014 to 2018. Just to match demand, let alone improve access, we're going to need to have 3.6%. So these are big numbers, but without them, the promise of the support for the people that need these services, and it's a sector that stands on its own, but the effect on the NHS can never be discounted.
No, absolutely. I mean, we're always a little bit twitchy in social care about talking about ourselves in the context of NHS, but politically and as a society, absolutely, it has to be put in that context. If you don't invest in communities, if you don't invest in social care, if you don't invest in preventative measures, you will end up driving people to either a poorer level of health where they draw on emergency care and acute care in an inappropriate way and an unnecessary way, which has an impact on lives as well as funding, and you will draw on services that should be focused on acute clinical care, not picking up shortfalls in social care provision.
No, absolutely. You talked about workforce plans. The NHS has a long-term workforce plan that has been published. There is a Demand Care England that produced a report about the sustainable future for social care in September, and one of the demands over a 5-year period is to have a fully funded workforce plan for social care. So people are calling for it, and I think it's important because the social care workforce is being asked to do more complex work at home where the policy directive is going. So what's your thoughts around the imperative of that and the prospects for it?
Yeah, I mean, we've been calling for a workforce strategy as a sector for some time, and that links in again with the funding around if you don't map out the demand on your workforce, if you just keep talking about how there's not enough workers, how people can't attract or retain in social care, treating social care like it's their fault rather than looking at the fundamental issues that create that position, then we're not going to move on. We're going to just be in this perpetual loop. And I know that Skills for Care and Department of Health and I think Care England representatives are working on kind of, in a way, producing another kind of workforce strategy that kind of mirrors that NHS position, in the hope that we map something out. But it's great mapping out. We've got lots of documents that tell us what social care needs. We've got lots of documents telling us about our workforce profile and the risks and challenges that are ahead of us. Again, without funding, without looking at how we're going to really address that, then unfortunately they'll just be bits of paper again. Very interesting, very worthy, but will they make that difference? We need the funding to underpin the workforce strategy. And
that becomes incredibly important when you look at the projections of how many more workers are needed in social care. You can pick your number, 480,000, 450,000, and potentially with the demography of the workforce, I think 430,000 could leave because they're 55 and over. We're going to need some innovative pathways and models for training, aren't we, as well, if we really want to come into the sector?
Yeah, I think we have to again look at funding for training. So, speaking with Newcross earlier, and just looking at how do we help fund training? How do we help more vocational scholarships or vocational apprenticeships where people can earn and work and learn at the same time? Learning development for us is critically important, but we have to invest in that largely by ourselves because there's not a lot of funding coming into the sector for learning and development. We've just got so many challenges. And then there's a challenge of international recruitment and how to do it properly and whether we're going to need it long term. And there's obviously a lot of government talk on that, which is very negative, rather than looking at the skills and the valuable contribution that people are bringing into healthcare. And certainly if it wasn't for the international workers over the last 12 months, I think our workforce statistics would be even more dire than they are.
Absolutely. Well, let's see if there's going to be any meat to the bones in the run-up to the election. You're an inspiring advocate for the sector. I think you're on record as saying in that interview, in the absence of reform or change, in the face of growing demand, people are taking back control. It is time to promote the sector as well, notwithstanding all of these things. And I think you referenced some of the great work that Social Care Futures is doing in that regard.
Yeah, no, absolutely. I mean, Social Care Future is gaining momentum. They're really starting to do some community connect work, and hopefully there'll be some more campaigning coming out. We've got sessions next week on it. And as a team, I think it is that kind of radicalisation in a way of the changing the narrative in social care. I don't think, I think there's a place for everything. I think those of us that have been lobbying for a long time in social care, you don't want to just stop, but that it's not as effective as it could be. We're not having an impact. We're still not, getting the funding. We're still not getting the political attention that we need. So you have to accept that narrative is simply not working effectively enough. We've made movement. I wouldn't want to stop. I think it's absolutely important. But I think this voice of people with lived experience, people who are drawing on care, people who are saying actually what you're doing isn't working, we need to be a bit more radical and we need to change the messaging and we need to maybe shock and be a bit more confrontational, is also needed. So I really welcome, I think at the moment we need to get those two worlds to align. We need the kind of more traditional social care sector lobbying and representation people to kind of merge a little bit with social care future without diluting it. We need to support and embrace that change of direction. So because the last thing the sector needs is more division and
well, maybe those two rivers of advocacy could to join and create a torrent. Let's wait and see.
Yeah,
on that hopeful note, as always, Raina, it's an absolute pleasure to share time with you, and I hope you'll come back and join us next year when we're launching and focusing on what's the future of social care in the light of the general election.
Of course, that'd be lovely. Thank you for having me today.
My pleasure. Thank you so much.
Thanks.
Delighted to welcome Michael Manuccia, CEO at FuturU, to this special episode of Voice of Care. Michael, thanks very much for taking time out of a very busy day to join us.
Yeah, great to see you again, Suhail.
It's always a pleasure, and special day, I think, special care show for FuturU, big launch, and huge amount of buzz here.
Oh yeah, it's fantastic to actually talk with nurses, care workers, and care home managers and hear their response to what we're doing. We've had hundreds of care facilities sign up today, and thousands of people over the course of the last few months that are getting onto the platform. Tons of enthusiasm, and they ask the same question: How is this free? And when we tell them the mission and everything that we're doing, they're just tremendously excited.
You've been gracious enough to give us your time before on Voices of Care. It seems like a lifetime ago when you set out on the mission, universal free access to healthcare education globally. Tell me what's been happening over the last few months. It's unbelievable.
So we've got over 70,000 people on the platform now, and a lot of the software tools that we've been building trying to solve the problem of assessing physical skills but virtually. We're debuting one of them today, a moving and handling training that allows for an objective and consistent feedback for someone when they're getting certified for moving and handling. So I'm really excited about some of the tools that we're bringing into the mix and the overall impact of what we're doing in the community.
Absolutely. Now, another thing that's happened since we last spoke, the NHS has issued its long-term workforce plan back in June 2023 to plug that gap within the NHS workforce, 260 to 360,000 clinicians. Just want to talk about the NHS briefly. I know it's a care show, but let's focus on that. A couple of predicates behind that plan: productivity assumptions, and they've made learning and development and healthcare education and innovation in it central to delivery of that plan. I guess this works right to the sweet spot of what FuturU can offer.
It does, and our core philosophy that the learning and the education always has to be free is an essential part of getting the people that we need into care and keeping them there so they can advance in their career and not have to pay money out of pocket. Another key bit that you mentioned on the productivity, we're expecting according to the workforce plan, a doubling of the productivity, which is kind of wild, and there's not a lot of specifics around it, right? Something that I hope that we're going to be able to do is show how people can learn in the flow of work, save people time, be more objective with their assessments, and make it accessible wherever and whenever they want to learn. Doing these things, I think, can open up a lot more time for staff to focus on other things and meet some of those goals. But the NHS has to be serious about engaging with early stage companies that are doing disruptive things, make it easy to get in, because as we well know, the most exciting things, they're not always from large established providers. Making it easier for smaller entities to get in is one way that they can help make sure that the productivity goals are met.
And if they want to turn the dial on education and training, as you say, it's got to be a much more holistic, open view to that. One of the other assumptions around the NHS workforce plan was, of course, retention. We can't be losing workers, and that applies to social care as well. And one of the key things there, I know you're familiar with the stats, there's a frightening number of people leaving the NHS, social care, burnout, wellness. I think in May, 25% of those who were sick was poor mental health. And I think part of the FuturU offering has now expanded to absolutely support retention as well as growth.
Yeah, we've had thousands of hours of people engaging with our wellness and well-being content, and we hear from them all the time that it really helps them get through their day, be more resilient. For us, it's part of the big picture of it's not just someone's career path, It's not just the learning they take, but their wellness and their ability to be in this job needs to have support just as much as everything else.
No, absolutely. I want to talk about nursing, if I may, to wrap up the conversation, because nursing is actually a very significant part of the social care workforce. That's not always well known. People think of care workers, but nursing is a very significant part. And of course, the NHS workforce plan assumes 170,000 new nurses over the period of the next 10 years or so. Now, one of the challenges with that, the stats from Nuffield Trust, recently in its report and analysis found that 13% of nurses, while they were training, dropped out. 20% left the profession altogether within 2 years. And people like the RCN and Nuffield Trust are calling for loan forgiveness as a solution. Now, I think this goes back to that mission of actually, if you're going to turn the dial seriously, you need to take that out of the equation.
Yeah, so number one, why we're using AI, why we're using software tools is to bring down the cost of the education and bring down the cost of assessing it. Specific things that we think AI is going to be able to add value on so that we can give away the training and the education for free. Then there's an idea of micro-credentials where we make small skill-based certifications for people that they can stack, and that can exist alongside other parts of the educational system, a proper nursing bachelor's degree, for instance. But we're losing 12, 13%. It's thousands of people a year that have skills and abilities. They just don't get them signed off on. So if we make fundamentally some of these educations and degrees stacked with micro-credentials, those people can still add value into care because they still have skills. And then they can always come back to it and matriculate through the rest of the process at a time and date of their choosing.
One of the key aspects of the FuturU platform, of course, is that it speaks to the zeitgeist within health and social care integration. That healthcare, social care. The platform allows those who want to move from care, develop their expertise to become nurses, and have a far more multidisciplinary approach to healthcare education.
Yeah, exactly. We're all about supporting people with flexible learning when and where they want to get that training to get to the place they want to go in their career, and doing with things like micro-credentials that can stack and help them build a career in care for the long term.
Well, thank you for that, Michael. Over the next 12 months, we're of course going to be entering into a general election where these issues and how we're going to train, retrain and grow the workforce are going to be vital in all that debate. We hope you'll come back and join us in a future Voice of Care episode to discuss that. But in the meantime, thank you so much for taking time out of your busy schedule and sharing your wisdom.
Great seeing you.
My pleasure. Thank you. I'm delighted to welcome Lucy Campbell, CEO at Right at Home UK and Vice Chair at the Homecare Association. Lucy, thank you so much for making time out of your busy schedule to join us at Voices of Care.
It's an absolute pleasure. Thank you for having me.
No, it's a delight. I've seen that you've been around on the floor here. It's a tremendous care show, it's massive positivity. What have you been finding? Lots of busy people, lots of conversation.
It's been a fantastic couple of days actually, because we had our Home Care Association board yesterday, Leaders of Care Awards last night, where I was thrilled because Jane Townsend got some amazing recognition. Martin Jones of Home Instead did, and also we did at Right at Home. So it was a real win for the Home Care Association actually last night, which was amazing. And then to come here today, it's just amazing. It's the people that come that make it. Essentially most people are here for the same reason, to make an incredible difference. And yes, there's some amazing providers here. It's always good to see what's up and coming in terms of technology, and there's been some great talks as well from both kind of home care partners. I was in the technologies theatre earlier as well, so yeah, really cracking day.
No, and congratulations on the recognition. Just to touch upon that, Right at Home, I think it's been a 12-year journey. You've been there for a chunk of that award-winning franchise. Tell us a little bit about the business, because it's been on an extraordinary journey over the last decade.
Yeah, so I consider myself really, really blessed with the opportunity that I've had. Our founder, Ken Deary, he's the chair of the organisation and the owner. He was formerly a McDonald's franchise owner, Golden Arches award winning, so really at the top of his game, but he wanted to really make a difference, and burgers and fries weren't really hitting the spot for him. So he had a care home as well, so he knew the industry, and he went over to the States and he found Right at Home, a brand that was in the quality end of the home care market, and he thought, yes, I can do this in the UK. So he set up a pilot office in Preston, purposely an area which he wasn't overly familiar with, because he really wanted to prove that it worked, and he did. And yes, 12 years on, the rest is history. We've got over 80 locations now. 34% of our locations are rated as outstanding by the CQC.
It's tremendous.
And we've had some amazing recognition along the way, and Ken has been just the most terrific mentor I could ever have imagined having.
Well, congratulations. That's a brilliant story and a good one to celebrate the sector as it should be. Obviously, the sector, home care, as well as care home and the broader adult social care, does have certain challenges. We all know that. But I wanted you, with your vice chair hat on, in terms of the Home Care Association, we are still seeing funding constraints impact the sector, delayed payments causing problems for smaller and medium-sized companies and larger companies. So there still needs to be a policy initiative that grabs and possibly really honours what the home care sector does.
Without a shadow of a doubt. And it's interesting, again, when you sit round the board of the Home Care Association, we've got representatives from all parts of the home care market, ones that are predominantly private, ones that do a blend, and ones that do purely government work. And none of us are not being faced with similar challenges. That is an absolute certain. From a political landscape point of view, certainly the Conservatives are really not going to be paying social care any attention. We know that because of previous commitments that haven't been delivered on, and as a sector, we really need to do all we can to make sure that social care is absolutely on the agenda. There's huge challenges in the commissioning space, so we need to pay our workforce well. Workforce is a massive challenge, but in order to do that, obviously government needs to be paying a fair price for care. The Home Care Association do a massive job on that with the minimum price for home care report. It opens doors, but unfortunately it doesn't always get the response that we want. And until we're getting a fair price for care, it's hard for providers that don't operate in the private space to pay as well as they would like, and that has to change. And the only way that can change is if we see regulation of the commissioning space, which isn't in place at the moment.
No, absolutely, and I think this has been an issue for a long time. You say the lifeblood of the sector is the workforce.
Without a doubt.
Without question, and yet funding, if we look at the King's Fund produced a report back in August 2022, 50% of the care workers, I think, are paid within 30 pence of the national living wage, and 9 out of 10 of the larger supermarkets pay more. So that we really are in a place where I think Helen Whately, the care minister at the NHS Confed, quite recently said we need to push the dial on hospital-like care at home, and that's getting more complex. It just doesn't seem to equate, does it?
No, we need parity of pay with the NHS, that is for sure. Our Right at Home, we do a lot of private work, which means we are in the fortunate position of being able to pay our caregivers more than the average, but that's not the case for everyone. And I can tell you, every single provider that I know wants to pay their caregivers as much as they possibly can. We need to professionalise the workforce. There is a shortage of caregivers, so we need to make it an attractive career for the next generation, and at the moment, unfortunately, they don't see the career prospects being there because the general consensus is it's not a well-paid profession.
And also, and that's borne out in terms of the career pathway with care workers who have been in post for 5 years, earning sometimes as little as 7 pence an hour more than someone who's worked for no more than a year.
Yeah, absolutely. I mean, one of the things that we're really trying to focus on now, with my Right at Home hat on, is actually the part we can play in the integrated healthcare agenda. there's a need for community-based home care providers to take on tasks that would be traditionally carried out within the health space. That has to be part of the solution. We've employed a clinical lead to allow us to start to provide some of those more clinical offerings in a home care setting, and that obviously opens up a really beautiful career pathway for our caregivers, for those that are wanting to carry out more sophisticated duties. But we're still not there on the commissioning piece, where we need to see that joint commissioning happening between health and social care so that we can truly make a difference.
And I think you've said it very eloquently. We're in a landscape now after the Health and Care Act where we have potentially integration, social care, health, voluntary sector, local authorities, and we need representation of the social care sector. But at the same time, how are we going to be able to deliver that? I think it goes back to the advocacy that you've done at the Home Care Association in terms of having the true cost of care being provided.
Yeah, without question. I mean, Jane, with the support of the board, does a tremendous job of, really trying to get these matters on the table and in front of the right people. The challenge that we've obviously had is there's been such a change in cabinet. Quite often it's, 2 steps forward, 1 step back all the time. Hopefully, when we finally go to election, we will have a party that will listen to us and we can start to make some headway. But it's not going to happen overnight, and it really is the care sector, I believe, that need to take matters into our own hands and drive the necessary change and become part of the solution instead of waiting for government to drive the policy change.
Well, absolutely, and a couple of things perhaps to end with is some of the initiatives that you've developed. I know training is really, really important because obviously career pathways, we need so many more care workers over the next decade. They need to be trained. There are traditional pathways. Can you expand a little bit about the work that the company does in terms of helping people to be trained to provide these very skill-based services?
So, I mean, a really, really important part when you're onboarding caregivers, quite a lot of them will come with no previous experience, and yet you're asking them to take on a huge amount of responsibility. So you need to ensure that they feel confident doing the work, otherwise you're going to lose them, sadly. So our training programme, right from induction through to our Managers Essential Standards training, is designed with quality at heart, so we don't rush it. We obviously pay our caregivers and workforce for that training, and we were delighted to get recognition from the Princess Royal Training Award as well, which is obviously a really highly esteemed accolade. So when our caregivers are working for us, they feel that they're being trained by the best, and obviously that supports with the retention piece massively. But on the clinical side, as I've mentioned, we've recruited a clinical lead. So we are now training our caregivers in various delegated tasks such as peg feeding, etc., stoma care, and many other aspects. And this is meaning that our caregivers feel confident. The feedback that we've had has been tremendous. We've now trained 300 caregivers since her appointment, and we're going to scale that up. It will obviously open up doors for our franchise owners to provide a much wider offering. But as I've mentioned before, for our caregivers, it obviously opens up those career pathways as well as making them feel really, really well looked after and cared for themselves.
And despite the challenges that you see, that you've talked about, organisations like Care England, Home Care Association, National Care Forum are now really imploring all parties that what the value of social care is, and obviously through your franchise model you're obviously very confident that social care, home care presents not only a great contribution to society but also an opportunity for anyone who wants to enter the sector.
Yeah, it's immense. I mean, we have an ageing population. The latest census data showed, a massive surge in over 65s. At the same time, hospital readmission rates are absolutely staggering. We have a huge role to play, not just in that really responsive care, but also in the preventative agenda as well. And I could talk forever about that. Technology's got a huge part to play. But if we are able to really do the preventative piece properly, it will alleviate the pressures on the NHS, which obviously save costs. And at the other end, if we're able to accelerate the hospital to home piece, providing virtual hospital wards at home, etc., We know particularly when you're dealing with the frailest of society who don't do particularly well in hospital, they're going to have a much better quality of life and hopefully a prolonged life by those sorts of interventions that the home care space can offer.
Well, I can only hope that the politicians are listening to these very eloquent, impassioned remarks. And look, thank you so much for taking time out of your busy schedule, Lucy. It's been fabulous to share time with you today.
Oh, it's been a delight. Thanks again for having me.
My pleasure. Thank you.
Thank you.
I'm delighted to welcome James Bullion, Chief Inspector of Adult Social Care and Integrated Care Systems at the Care Quality Commission. James, thank you so much for sparing time to join us here at the Care Show, and welcome.
Yeah, thank you very much. It's a pleasure to be here. What a lively show, actually.
There's some tremendous energy, and I know you were here meeting lots of providers, etc.
Yeah.
So a busy couple of days.
Yeah, definitely. Yeah, I mean, meeting people and giving an update on where CQC is at, and it's just so great to see the vibrancy and the, just the sheer numbers of innovations that are going on. Really great.
And actually, it's a sector that clearly it has many challenges, which we know, but it's a sector, and especially you see the atmosphere here, to celebrate, employing almost 2 million people. The report, a huge contribution to the economy, and you bring a wealth of experience at executive leadership level. I think Norfolk County Council, and I think you were president at ADAS, so it's in your DNA, as it were.
Yeah, I've been working in adult care for 30 years nearly, so definitely in my DNA. And to go back to what you're seeing around us here, it's just amazing. The obvious positives, like the difference it makes to people's lives, those are there all the time. But when you look round at the technology developments, the ability of using data in a different way to sort of predict things and to do prevention, there's some amazing stuff going on, really, that people wouldn't know about, that social care is probably one of the more innovative sectors of our economy and of our, partly through a needs must. We've got to develop because we have got all these constraints on us around funding or workforce. But it's amazing the stuff that's going on. Really, really good.
And your State of Care report, I know, is coming out shortly, so I can't teaser out the details yet from you. But in your last one, the CQC pointed out, I think, what Ian Trenholm called points of light that you're referring to in terms of the innovation, etc. And I wonder if you could give me an update, because one of the things that was really interesting was the new regulatory framework and strategy, smarter regulation that the CQC is committed to, single assessments. Can you bring us up to speed, because there's been quite a lot of announcements happening in recent months? Yeah,
definitely. It's a very timely question. I mean, we're on the cusp now of launching our single assessment framework and our new regulatory platform, so the interaction that we'll have with the population and with providers, different way of doing things, a new portal where people can register and interact and start their journey of registration or variations.
Is that November?
It is, yeah. So we're rolling out from mid-November in the south, and then rolling out around our networks in an ordered way, and we're seeking really proactive conversations and relationship with the providers in those areas. And we'll adapt as we go. We're not saying it's the finished product. We want to remain flexible. But I'm hoping that the technology that we use will be better for providers, and then the assessments we do will be more proportionate, and we'll be able to update the reports we have on people and update the ratings and the scoring that we have on people as well in a more flexible way. I think the current system is really challenged. Just the sheer numbers that we all have to get through every year to do the current regulation is really difficult for the marketer providers, but also it's difficult to understand as well in some ways. So we're really keen to push on with a different way of working from November.
And also your stakeholders are not, of course, only the people who use the services or the people who provide the services, whether it's adult social care or integrated care system level. It's also the general public, in terms of, I think, a key part of the CQC strategy that you're obviously leading here is engagement and growing awareness of what the CQC does. I think there's been some very positive moves in that direction.
Yeah, I hope so. I mean, we obviously try to give assurance in the way that we regulate to people about particular care providers or hospital or health services they're using, but also to give an independent voice to what we're finding, and really to speak out on behalf of the sector and to speak to government, to be fair, because we are an independent regulator. and that's part of the state of care report, is to make those points, but also to get public understanding up and to give a positive message. Otherwise, we're not going to inspire people to come and work and develop in care unless we are a mixture of pointing out where things aren't going very well, but also pointing out where things are going right, and incentivising further change and improvement. So our improvement agenda is a really strong part of what we do. We don't want to just regulate and, as it were, achieve change through punishment or negativity. We want to inspire improvement through learning and through spreading good practice.
And I think your work and your long career, of course, with Essex County Council prior to Norfolk County Council, perhaps gives you a unique vantage point together with AIDAS to see it from the other side of the fence, if I can put it that way.
I certainly come in with that knowledge, actually. I mean, I've been with CQC for 4 months now. I come as a former director of adult social services for sort of 10 years nearly. So I'm bringing that perspective, and I also am bringing, as it were, an independence, pointing back at what people are experiencing. So definitely bringing a social care perspective into a job that's looking at both social care and integrated care, and really trying to make sure that the I and we statements that we're now using in our regulatory platform are the heart of the way that we regulate on behalf of people.
And it really is a unique environment that you're coming into, in the sense of we've had the Health and Care Act, we've now got integration statutorily backed, so there's a great promise there, a lot of work to do, but a great promise to do, isn't there?
Yeah, there's a big opportunity. If the ICSs and if local authorities play their part in ICSs, then there is a big opportunity for integration. I mean, as ever, some of the constraints are around the resources, but most of this is not going to be about money, actually. It's going to be about changing the way we work between health and social care and housing, and working in a different way, and crucially making sure we bring care providers in as an equal partner into ICSs. I think one of their gaps actually is that relationship. It's when you attend an ICB, you often see the council, you'll see the Director of Public Health, you'll see the local NHS leaders. You don't often see care providers. You do often see the community through Health Watch and bodies like that, but we can't really achieve integration unless it's in the interests of care providers as well, and that's a crucial part of what I want to see when I go and look at ICSs, actually.
Integration is all or nothing in that sense.
Yes.
One final question. In your report last year, you talked about the need for more flexible workforce models, safety through learning.
Yes.
And as you know, we need a tremendous increase in the number of the workforce in social care. So I just wanted to touch upon that within the funding constraints and innovation. Traditional pathways to learning and development are there, but I think we need an innovation, and you say technology, maybe more digital, flexible ways to train people who want to join this social care sector. Yeah,
definitely. I think both CQC and also Skills for Care, both of us are saying the number of people that you need in our workforce to grow in the next 10 years is at least 450,000. That's a phenomenal opportunity for the economy at one level, but it's also a challenge. It's practically, every school leaver would have to go into care. That's just not going to be realistic. So there's a couple of things I think we need to encourage. First of all is to change the workforce, more men. There are twice as many men working in social care than there are in the British Army. So just to give a sense that it's not just about, unless we start attracting men into the social care workforce, we won't have enough women, as it were, working there. And then, as you say, technology is a crucial part of it. How can we, minimise appropriately some of the supervision through the use of technology and anticipate people's needs changing through that technology? I think the other thing is the international recruitment's made a big difference. Is that sustainable over the long term? I'm not sure, actually. We do need to not rely solely on that. We have got to attract people to come into the workforce from other sectors, and then finally the economics of it need to add up, and that's still outstanding. I think we do need a fair cost and a fair settlement for social care. Otherwise, it will remain constrained and gridlocked.
Well, I think on that point, that's enough for policymakers to chew on ahead of an election almost certainly next year on that. But James, thank you so much for giving us your time, sharing your wisdom, and I hope you'll come back and join us in the new year when we launch our next series and focus on the future of health and social care.
Yeah, I'd love to. Thanks for having me.
My pleasure. Thank you, James. If you've enjoyed this special episode of Voices of Care from The Care Show, please like, follow or subscribe wherever you receive your podcasts. And if you want to find out more about how we are truly enabling the healthcare workforce of the future, please visit newcrosshealthcare.com/Voices of Care. In the meantime, I'm Suhail Mirza. Thank you and look forward to seeing you on the next episode.